From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
On today's show, we're discussing the potential for an antidepressant to treat methamphetamine use disorder. I'm Kate Schweitzer, Associate Managing Editor of JAMA Medical News. Staff writer Samantha Anderer is here to tell us about it. Sammy, thanks for joining.
Thanks, Kate.
So, what do we know about this new treatment?
According to recent findings published in JAMA Psychiatry, the generic antidepressant mirtazapine may help reduce methamphetamine use. Now, it's important to emphasize that methamphetamine use disorder is notoriously difficult to treat. Because the illicit stimulant drug acts on a wide range of receptors, blocking its effects is much more challenging than doing so for, say, addictive substances like nicotine or opioids that target distinct receptors. In part because of this, no pharmacotherapies are currently approved by the U.S. Food and Drug Administration. But after a Phase 3 randomized clinical trial, there's more promise. The trial was conducted at multiple clinics in Australia, and about 300 adults were assigned to take either mirtazapine or a placebo. After 3 months, people taking mirtazapine reduced their use by about 7 days per month, which was 2 fewer days of use than the placebo group. Although that effect was somewhat modest, it was statistically significant, and clinicians I spoke with said that it may make a difference for some patients. And because mirtazapine is already well understood and safe, it may be prescribed for at-home use with limited clinical oversight. As one expert put it, it's benign, cheap, and widely used.
Sounds promising. Were there any notable drawbacks to mirtazapine treatment?
There weren't any unforeseen safety concerns, but about 47% of participants taking mirtazapine reported drowsiness, and 10% experienced weight gain, compared with lower rates in the placebo group. However, a clinician I interviewed noted that insomnia and weight loss are common symptoms of methamphetamine use disorder. He said that a subset of individuals may actually benefit from these effects.
So, Sammy, what are next steps? How might mirtazapine fit into current treatments for methamphetamine use disorder?
Well, it's far from a panacea. Experts said that mirtazapine isn't going to treat methamphetamine use disorder on its own, and that it should be used as a first step in a broader treatment pipeline and in combination with existing behavioral interventions, not as a replacement. They also expressed interest in seeing how it works with other medications that have shown some promise in the past, such as naltrexone and bupropion.
Thanks, Sammy. All right, if you'd like to learn more, we'll include a link to Sammy's story in the show description. This week, we also published a story on the American Heart Association's new Heart Healthy Eating Guidelines. You can find that and all of our stories at jamamedicalnews.com. Thanks to Samantha Anderer for joining me. I'm Kate Schweitzer from JAMA Medical News. This episode was produced by Daniel Lucisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.